Celiac disease, a chronic autoimmune disorder triggered by gluten. It causes an immune-mediated injury to the small intestinal mucosa, leading to malabsorption, and gastrointestinal and systemic symptoms. The immune response involves both innate and adaptive mechanisms. Gluten peptides are deamidated by tissue transglutaminase, or TTG, enhancing their binding to HLA-RDQ2 or HLA-RDQ8 on antigen-presenting cells. This activates CD for T cells, resulting in cytokine production and epithelial damage. Simultaneously, Illinois-15-driven innate responses promote epithelial stress and cytotoxicity. Over 95% of patients carry HLA-RDQ2 or DQ8, indicating a strong genetic link. Yet, environmental triggers also play a role. Viral infections by enteroviruses have been linked to immune dysregulation and loss of gluten tolerance. Antibiotic exposure may disturb gut microbiota, increasing intestinal permeability and inflammation. Symptoms vary widely. Classical presentations include diarrhea, abdominal pain, bloating, and weight loss. Others develop extraintestinal signs, iron deficiency anemia, osteoporosis, and more. Some remain asymptomatic, diagnosed accidentally. Emerging evidence highlights the importance of gut microbiota in disease expression. Dysbiosis, marked by reduced bifidobacteria and increased proteobacteria, exacerbates inflammation. Food additives, like transglutaminase, can mimic TTG and amplify immune responses. Ultra-processed foods may further impair gut barrier function. Current treatment is a lifelong gluten-free diet. However, up to 40% of patients exhibit ongoing mucosal damage despite adherence. Botanical therapies, like curcumin, show anti-inflammatory potential. Slippery elm, marshmallow root, and licorice root may aid gut healing. Probiotics and prebiotics are a target for rebalance microbial populations. Nutritional deficiencies are frequent, requiring supplementation with iron, calcium, vitamin D, and B12. Thank you.